Hello people, namaste, welcome back to my channel. In this video I will discuss this continuation of drug dependency and abuse chapter from forensic medicine. In previous video I discussed about the drug dependency, one of the important question for university exam. In this chapter I will discuss some of the important short answer questions from this chapter. First one is body packer syndrome, next one is body stuffer syndrome. What is the body packer syndrome? The act of swallowing what are swallowing, like containers or some condoms or some balloons or some plastic bags of packers. These are filled with some illegal drugs for purpose of smuggling has been termed is known as body packing. So the act of swallowing of these containers or balloons or condoms or plastic bags of packers which are filled with illegal drugs for purpose of smuggling. This for purpose of smuggling we can call this body packer syndrome. One packet consists of 3 to 7 grams. Consists of 3 to 7 grams. Means generally they use it to carry half kg. When they carry half kg, so each packet consists of 3 to 7 grams. See the next, the drugs such as loperamide, diphenoxylate hydrochloride plus atropine. These are the drugs used. Okay, so these are useful for reduction of gut motility. What are the drugs? When the smugglers take in these containers or some packets for reduction of gut mobility, they uses the drugs like loperamide or any diphenoxylate hydroxychloride HCl plus atropine should be used because they reduce the gut motility. Because of reduction of gut motility, they can easily transport the drugs. One of the important point is courier's death. What is courier's death? When these packets burst, when the packets become unsealed or burst, when the packets become unsealed or burst in the small intestine, especially the cocaine filled containers, it leads to courier's death. It leads to death of the person when they burst of these packets in the small intestine, especially the cocaine filled containers, leads to death. So this is called courier death. If not ruptured, the osmotic seepage of across the latex warping allow the small intestine drug to appear in circulation, and if not ruptured, but we can tell them they are smuggling something by knowing that by knowing by circulation or by urine, these drugs enters into the circulation and urine. So when we check the blood and urine, we can know that they are smuggling some drugs. They are smuggling some drugs by knowing by laboratory testing of blood and the urine, because while smuggling, the some of the small amount of drug will enters into this circulation and urine also, appears in circulation and urine also. This is called body packer syndrome. Means they are smuggling act of smuggling is called body packer syndrome. Next, body stuffer syndrome means person arrested swallowing illegal drug for concealing the evidence from authorities. When the person stuffers means they when the police when they are arrested, when the evidence is there because of so when the person arrested, when smuggler person arrested, then they swallow these illegal drugs, for concealing the evidences from the authorities, to telling I'm not taking the drugs. So for concealing the authorities, this suddenly they swallow these illegal drugs when they are arrested to the authorities. Now where the drugs can be, they can put in the ear, mouth, nose, vagina or any rectum. All these canals they can put these packets. Next, this how can we diagnose? By diagnosing by X-ray, CT scan and barium contrast. X-ray of the abdomen and CT scan and barium contrast. Next, what is the treatment? Treatment is diazepam. For to calm the patient, we can give diazepam followed every 5 mg. For every 5 minutes we can give diazepam. Next, glucose, thiamine, multivitamins also given. Fluid, electrolyte balance and oxygen should be given. So this is the body stuffer syndrome. So these two are important short answer questions. So I will tell. See, First one is body packer syndrome. What is body packer syndrome means? They are smugglers. They are trying to swallow these all illegal drugs in the form of containers, condoms or balloons. So they are smuggling. The process is called body packing. One packet contains 3 to 7 grams, so half kg they will travel. So decrease the gut motility, they use a loperamide and diphenxylate HCl plus atropine. Courier's death. Courier's death means when the sudden breakage of sudden unsealed or burst in the small intestine, it leads to death of the person. This is the Courier's death. And body stuffer syndrome means the people arrested, they swallow these drugs for concealing evidences from the authorities. Swallow these illegal drugs for concealing evidence from the authorities. So where they can put in the ear, mouth, nose and vagina. Rectum diagnosed by, how can they diagnose it? They can diagnose by X-ray of abdomen, CT scan, and another one is barium contrast. And what is the treatment is? First you should give the diazepam to that patients to calm them, 5 mg for every 5 minutes. Next you should give the multivitamins, thiamine and glucose also, and fluid electrolyte balance, also give oxygen. So this is the body packer and body stuffer syndrome. Next we can discuss about the solvent abuse. What is solvent abuse? Volatile abuse. Solvent abuse means volatile. Solvent means this is a volatile abuse. Involves the deliberate inhalation of substances like toluene, aromatic hydrocarbons, petrol, xylene, benzene, methylene, ethyl chloride. Some you can remember some of them like toluene, aromatic hydrocarbons, petrol. All these are volatile substances. Involves the deliberate inhalating some inhalating deliberate inhalation in from the substances like toluene, aromatic substance. This is called solvent abuse. We are abusing this volatile abusing these substances in the form of volatile inhalation. Okay, this leads to psychotropic and hallucinating properties. This is to psychotropic and hallucinating properties. Some words are huffing and bagging. Huffing means inhaling vapors from the cloths that is saturated with volatile substances and held near to nose and mouth. Take some cloth and in the cloth these volatile substances are put in that cloth. So they used the cloth by inhaling vapors near to the mouth and nose. So they inhale these vapors. So this is called hugging. What is bagging? Hugging means in the cloth. Bagging means in the bag. Inhaling or exhaling into the bag that has been filled with small amount of volatile substance. So hugging, bagging comes under volatile substance. Volatile abuse, solvent abuse. Next, gaseous substances are also present. They are they are generally carried in a cylinders or small ampoules. They are put at the mouth or nose. So these are carried in these containers like large cylinders or small ampoules. When the shifting is done at the nose or mouth by putting the nose or mouth at the neck of the container from gaseous substances. Next, what are the symptoms? Symptoms are the feels powerful dreams and heightened sensations and detachment from reality. Means they are assuming they have high dreams and heightened sensations and detachment from the reality. May injure or kill himself also. Later amnesia will come. It is most commonly in males. A major cause of death is because of sudden cardiac arrest, hypoxia, hyperpyrexia, asphyxia, aspiration. All these occurs. Hypercapnia. All this leads to major cause of death. So these are the important points in solvent abuse. Solvent abuse, you can write these are the volatile substances like by inhaling, volatile inhalation, volatile substances inhaling like toluene, aromatic hydrocarbons, all this petrol, xylene. Some of the examples you write. After that leads to psychotropic and hallucinating properties. Next point. Next you should write about the huffing and bagging. Huffing means in the cloth we can take the volatile substances, put at the mouth and the nose. So bagging means in the bag we are putting the volatile substances by exhalation, inhalation. Next, some gaseous substances travel like large cylinders or some ampoules by at the neck of the container, shifting of these volatile substances. Next, what are the symptoms? Like you should remember symptoms: feel powerful dreaming and heightened sensations and detachment from reality. Sometimes injure himself or kill others. Later amnesia, most common in male. What are the cause of death? Cause of death is sudden cardiac death, hyperpyrexia, asphyxia, aspiration, hypercapnia. All these occurs. Okay. These are the some of the three important questions from drug dependency and abuse. Thank you. Please subscribe my channel and please support us. Thank you.